Well, good morning, everybody. I'm Vicki Liviakis, and welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures. We also take your calls live on the air. With us today, we have plastic surgeon Dr. Joseph Mealy, and we're going to be covering two topics, specifically liposuction, which a lot of people want to know about, and breast reduction, which I don't think a lot of people know about this. Later on, we'll be taking your calls on all the subjects, the phone number rather, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, obviously you're going to also want to consult your own physician. Welcome back to the program, Dr. Mealy.
Nice to be here.
We're going to start off talking about liposuction. I mean, this is very, very common. Is that like one of the top
It is usually the top,
done?
#1 most frequently performed cosmetic plastic surgery procedure in the U.S.
And, of course, because we are so obsessed with dieting and the body and whatnot, I mean, how much can you take out?
Well, it's a complement to diet and exercise, and I think the diet and exercise certainly should have the priority in terms of weight control. But in terms of sculpting the body, changing the shape of the body, that's where the liposuction really can gets involved, because you can pick where you want the fat removed from, as opposed to just removing weight. In terms of the most that we could remove, there's a voluntary limit right now set out by the American Society of Plastic Surgeons to remove about 5 liters at one time, which is about 11 pounds.
11 pounds?
Yeah.
That's a lot.
It is a lot. But if someone's 100 pounds overweight, obviously removing 11 pounds not going to make a huge difference for them, and that's why it's not a good form of weight control.
There are a lot of new things out there. You get your Smart Lipo, Lipo Select, Tumescent, Liposuction, Lipo Dissolve. I mean, what are these things?
They're sort of brand name liposuction. So it doesn't mean they're better than generic liposuction, but they are marketed by companies that make specific products that are designed to enhance the results of liposuction. I'm not sure they're necessary for everyone, but I like to have them available because there are certain sort of specific situations where they can enhance the results. One of the methods uses ultrasound, ultrasound energy. Basically, it's vibrating the fat cells fast enough that you can liquefy them to ease the removal. It can also be useful for areas that have had liposuction before that were repeating, or areas that have scarring, where it's just difficult to get the cannula in without that additional energy.
Are some forms, some of the newer forms, more, let's say, fine-tuning types of procedures? So that in
some ways. I think for the vast majority of people, tumescent liposuction works great, and we don't really need to add a lot. With each of these new modalities usually comes some downside. Like with the ultrasound, it's possible to burn the skin. It's not possible to burn skin with liposuction normally. Because of that energy is there, if you put it up against the backside of the skin, you can cause an injury. So it's important to know how to do it and what to do. Okay,
now the most common area that you lipo is the abdomen.
The trunk tends to be the most common area. So abdomen and flanks for men, abdomen and thighs for women tend to be the most common areas.
Now, but I've also seen photographs where, say, in the neck area, if you're carrying a little bit too much fat in that area, you can lipo.
Well, I describe it to my patients like the fat cells have numbers on them. So it's like when you go to the deli, now serving #1, #2. Wherever those low numbers are is where the fat goes first. So if someone is thin and has a big pouch here, liposuction can selectively remove that, whereas weight loss may make them look too thin somewhere else before this goes away. More commonly, it's the upper and lower part of the body that get out of harmony.
Okay, so again, for those people who have tried diet, exercise, and they seem skinny enough, I mean, in most parts of their bodies. I mean, this is just your last resort of working an area that just won't respond to anything else?
Yes. I have more than one patient who's come in and they've said their friends don't know why they're doing it, because they look great. They're thin. But they're adjusting what they're wearing to cover areas that just don't go away. Sort of the ideal patient for liposuction is someone who's in shape, they're close to their ideal body weight, but they've got bulges that won't go away. And the liposuction is there just to tailor that to get rid of those spots. Well,
we have a lot of calls, people obviously interested in liposuction. We need to go to a break really quickly here, but for more information about Dr. Mealy, you can call 925-943-6252, or you can check him out on the web at drmealy.com.
It's 6353.
Oh, let's get that straight. It's 6353. Okay.